on their mind. Thank you for sharing that. My question now is about your experience that you have now being a medical affairs leader. How has your view of the MSL changed from the first time you have your first MSL role to now becoming medical affairs leader?
Well, I think the role itself has evolved a lot over time since I started in it. I think there are more people doing it. There are more organizations that understand that they need MSL teams to help them, especially either in the pre-launch to launch phase or even in the early clinical development phase, right? Like the understanding of what MSLs can do to help an organization prepare for commercialization is way different than it was back in the day. So I think just the knowledge of what the role is and how many companies have um, worked to build and expand that capacity, that has absolutely evolved and expanded over the years. That said, I think more recent times, there, as companies go through reorganization and trying to figure out how to navigate what MSLs can do and what the world of AI and fit for purpose messaging and things like that, it's getting a little bit more mixed up, right? Some organizations are really pushing their MSL teams to be as close to the edge of like their messaging, right? There's a scientific messaging. How do we do that? How do we do that compliantly, but in a way that is continuing to make sure that we're having an impact on what we do versus earlier days it was probably a lot more opportunity just to go forth and be brilliant, right? Also, there was an evolution of the MSL role. It used to do a lot of what the role of thought leader liaisons do now. MSLs used to do things like that, speaker programs, and those have been separated out, but now sometimes the MSLs are the ones delivering the program depending on the company they work for. There's different rules on how MSLs and commercial can work depending on the organization. So I feel like right now the role itself is under a little bit of flux, and it's dependent on the particular organization and where that organization is in its commercialization lifespan and how many products they have. So I think there's also some companies that are moving toward, well, I have a team of brilliant people that know how to work with people. I'll just keep moving them around from one therapeutic area to another. And anyone who's worked in this for a long time, myself included, I feel like that's a frustrating evolution because we know how much energy and time it takes to build a relationship where that trust for scientific exchange comes in. But it's another way that companies are trying to get the most from their teams.
Good, good. Thank you so much. Is that what you call the MSL diva in the book? The book?
No, okay, MSL Diva, yeah, I know. I almost didn't include this part of the book, but I think it's important to know. So it's been fascinating to me, and it was fascinating. I experienced this more when I was an MSL early in my career, and I had come from academia, and I had been, you know, toiling away in my own little space. And then I got into this role and I was just so grateful to have this new adventure, right? I'm learning great science. I have the potential to make this big impact on therapeutic care. I meet with all these brilliant people, whether they're outside of the company, inside the company. I'm paid generously. Like I feel so grateful for this. And then I would go to these team meetings and everybody was like grumble, 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 KPI, magic, blah, blah, blah. And they always had something negative to say. And I was just like, dude, do you understand how great your life is compared to like where I just was? And I've held on to the gratitude for that role and this whole experience has given me. And I obviously have had many colleagues who are the same in terms of that. But every once in a while, when you meet someone who's just like more what's in it for me, that's the diva. Like, do you remember where you came from? Like, so yeah, that's my
Yeah,
diva
good,
rant.
good. Thank you so much. Thank you for sharing that. I just find that very interesting.
Yeah.